Hi, everyone. It's Margaret Wallace Duffy, the founder of Preventative Health Month, which takes place every February, and Movement, this grassroots initiative that is picking up steam like never before. When I started this 3 years ago, I had a vision and a passion, 30 years of passion for preventative and integrative medicine. And so PHAM was born to break down the silos in healthcare, to have healthcare professionals from all disciplines working and learning and growing better together, but with one mission in mind. And that is to put the patient at the center, to empower them with tools and evidence-informed strategies so that they can become the CEO of their health. There has never been a more important time in history for us to look at prevention over reactionary medicine. Many of you know my story, but recently I boldly shared my story like I'd never done before. And why is that? Because my story has been a very challenging one. Although it was the foundation of my career and life's work in this preventative and integrative health space, it was something I didn't share easily because for years I was gaslighted, criticized, and really tossed aside when I was struggling with excruciating pain with a disease that went undiagnosed for 10 years. I'd never really wanted to claim the name of that disease because I was always told I was just a hypersensitive only child and a drug-seeking teen and a national athlete with a nervous stomach. And so until recently, when I happened to come across an article about a new revolutionary, groundbreaking Tier-One diagnostic test for endometriosis, you heard it, I'm an endo warrior. I always talked about having a chronic disease that led to 10 surgeries, 4 bowel obstructions, a lung collapse, and early menopause. But I stayed quiet about the name of that disease because no one would listen until now. And I got to tell you, I am beyond excited because now, as the founder of PHAM, as this is picking up momentum across the country and into the US, over 75 healthcare professionals putting their hand up and partners saying, we want to join this movement. One of the dearest and closest to my heart now is the woman I get to bring on the screen with me right now. And her partner, the founders of Endo Diagnosis, Inc., have become kindred spirits in just under a month. And why is that? Because they not only see my vision for preventative and integrative medicine and empowering women to take back control of their health and become the CEO of it, but because they also understand the endometriosis story far too closely. And so Maria Porcelato is here with me from Endo Diagnosis. Maria, it's been a whirlwind the past month, and we've got a big announcement to make, and I'm so excited you're here.
It's great to be here. And I think that this is a long time coming. And all of the work that I've done as a clinician for, the past 14 years, the passion I put into my career to help women, now it's coming around where we can make a really solid difference in a meaningful way, in a very simple way. And I think that's what I like about Endo Diagnosis is that we are not trying to complicate things. We're trying to make it easy. We're trying to make a difference for women, for their families, for couples with just one disease state. And we want to bring everybody together. As you said, your whole movement, Margaret, is all about bringing people together, bringing patients together, bringing healthcare teams together to help do what we were always meant to do. We're living in a very broken healthcare system where we're playing whack-a-mole, where we're putting Band-Aids on people because we don't really understand what they're going through. And finally, through your movement with PHAM and with Endo Diagnosis, what we're able to do is help these people understand what it is that they're dealing with finally. They're getting the answers. They're being listened to like never before. And I think the listening aspect is what has been missing all of these years. And so I'm very excited to be part of this. And thank you for being so open and inviting and bringing us into the fold of this wonderful movement.
Well, I've never been more excited to invite you into our family, PHAMILY. And for those of you that are watching, Maria is a pharmacist. She's also worked in the infertility space for a very long time. And for those of you that know anything about endometriosis, a neuromuscular immune disease, it impacts every aspect of life. And certainly infertility is one of them. I went through infertility treatments. I'm blessed to have 2 children, but they're 6 years apart. And this story is deeply personal for me, and having the opportunity to work with you and your partner, Carolyn, with Endo Diagnosis in order to bring this to Canadian women across this country. But here's the key. This Tier-One diagnostic test that we are rolling out in Ontario, this is the big announcement. August the 11th through the 13th, we're calling it the Endo Roadshow, the first time ever in Ontario, taking it into communities, even rural communities. That's right. Those wonderful women who normally have to travel to get access to testing like this, revolutionary testing, doesn't normally happen in the rural communities, but it does when we are part of it. We are bringing this type 1 test, which, let me be candid about what's currently taken place for 40 years. The only way to truly diagnose definitively endometriosis is through laparoscopic surgery. I've had many of those, and in the early days for diagnosis purposes, and was told I didn't have endo. And one of the partners that is working with and alongside us, our most responsible physician, Dr. Christy Prouse, who's an OBGYN, who's trained in functional medicine, was the founder of the Institute for Hormonal Health. I can't think of a better person, a gynecological surgeon, who knows firsthand. She's done these surgeries, and she said, often it can go undiagnosed, which happened to me, because the disease has to proliferate, the cells have to proliferate in order for it to be seen by the eye. So you can have a pelvis full of endometriosis and not be able to see it. This disease is really powerful because you can have a lot of symptoms and little disease. You can have a lot of disease and a lot of symptoms. And you can have silent endometriosis. And you know this, Maria, from your years in infertility work, or women that are struggling with menopause. Maybe it is actually undiagnosed endometriosis that's also wreaking havoc. This test now is not going to require surgery. In under 45 minutes, with simply putting leads on your belly to look at the myoelectrical activity of the gut, similar to what we do if you had an ECG to check your heart. You sit back, you relax, you drink some water, and with 99% accuracy, you heard it right, 99% accuracy, you are going to know if you have endometriosis or not. Now, even if you have endometriosis and maybe you're going through treatment, I've been there, I've done this over the last 40 years. And you might be told, oh no, it's fine. It's the treatment's working. And you know, in your heart of hearts, it's not, because you're the one living in your body. This test will tell you and help guide you through your integrative health treatment so that you can live the life with vitality that you deserve. And Maria, you've seen this firsthand, how this can be game-changing in under 45 minutes, non-invasive. And now we get to bring it to Ontario as part of the PHAM movement, thanks to Endo Diagnosis. How excited are you for next week?
I can hardly believe it. Carolyn and I, the co-founder, Carolyn Placairn, and I have been working hard for 14 months to bring this technology forward. Actually, when we first heard about it, we could not believe it ourselves. We thought, how can this be? We have been dealing with these women and couples for years, and we've seen them struggle. We see that they have not been validated for what they're going through. They are just put on, birth control and said, oh, here, take some ibuprofen for the pain. And, that's just the way it is. And so when we found out that this Tier-One test is available to identify it that quickly, we thought, great, who's got this available? Because we want to start sending people here. They need to know this. This is important. This is a game changer in the gynecological world. It's a dream come true, actually, for gynecology, making things simple. And when we found out that it wasn't available in Canada yet, our mission was, let's make it available. Let's find out how we can make it available. And of course, having a science background, pharmacy background, I spent 18 years working with Alberta Health Services in the poison specialty area and drug information. And so I knew that it had to have robust studies and research behind it. So I was delighted when, I found out about the research that was there, how the way that this Tier-One test works was so simple. It made sense. It wasn't complicated. I didn't have to crack open a physiology book and start trying to figure out how this worked. So there are 6 studies that are available right now that are being done worldwide. And we are so excited that everything is coming together. Everything is lining up. And we want to have a simple and accurate, as Margaret said, an accurate test, 99% plus for this test. These are very, very important things when we bring something into the healthcare sphere. We want it to be something that is going to change the mindset of clinicians, and as that is happening, help the people that we've set out to help.
Exactly. And as a science girl myself, as background in kinesiology, University of Waterloo, registered massage therapist, and I owned Wallace for Wellness, an award-winning preventative and integrative health clinic for 30 years, long before it was kind of cool to talk about preventative and integrative medicine. I knew from my own story with endometriosis that I needed to have both sides of the equation working together. When I say complementary healthcare, because I don't believe in alternative medicine, I believe in complementary and conventional medicine working better together, but with one caveat that I think is often left behind, and you talked about it with validation, and that is that the everyday patient, the person, is the most important member of their healthcare team. Her voice needs to be heard. And that's what this movement that we're doing. Yes, we're bringing a test to Canadians. Yes, we're making the research accessible. Yes, we're reaching out to media to make sure we can do our due diligence to get the word out. So if you're a media outlet out there and you wanted not just a positive story, but a revolutionizing healthcare story, reach out to us, because we can certainly give you the information you need. But the other piece to this is changing the future of healthcare requires a lot of pillars to think about. Talking to government officials, which the PHAM movement, that's at our foundation, is talking about how do we change policy. And at the end of the day, something like this, a test that you can get results in minutes versus 10 years for diagnosis, prevents the progression of disease. Maybe I wouldn't have had 10 surgeries and 4 bowel obstructions and a lung collapse if it didn't take me 10 years to get diagnosed. And at the flip side of that is, how does that impact our system? Well, if you get diagnosed earlier, here's this beauty in prevention. Here's the power in prevention. Not only does it improve the vitality and the health and well-being of the patient, but it saves dollars in the bottom line of our broken healthcare system. Surgeries cost money, meds cost money, often have side effects. Well, this simple test, that if partnering with community clinics can be done in the way that we're doing it in collaboration with Endo Diagnosis and PHAM and Dr. Christy Prowse, we're going to be able to actually give women their lives back, save dollars, but we're going to take and lobby government to talk more about the investment in prevention. But there's one other piece that we really wanted to talk about today, because these are the questions that I always get, and I understand. People are struggling right now, even to pay their bills. I get it. And not everything, I'm in Ontario, is covered by OHIP. However, we're also committed to doing our part to see that extended health insurance companies know about this. So benefits are going to cover this Tier-One Health Canada authorized diagnostic test, because it should be, because it's going to save not only insurance company, but the system's money. And so we are going to be talking, and we're committed to lobbying insurance companies so that it can be covered. Because here's the thing, and I know, Maria, you and I had a conversation last night about this. They don't know what they don't know. And I've had the privilege and honor of working with with a colleague to bring a new bone scan to Canadians that's not OHIP covered. And I always said from day one, do you want to be part of the solution or the problem? So I've encouraged every person that came to get a bone scanner, Osteocell REMS bone scan, to submit for their insurance. And they said, oh, it won't be covered. That's a mindset issue. We have to be part of the solution together. So send in your Endo Diagnosis test results or receipt to your insurance company. Because here's what I know through my experience with the bone scan and 33 years of doing this, even with massage therapy in the early days when it wasn't covered. Sending it in and continuing to get into the eyes of insurance companies and adjusters will eventually pique their interest, as it did with the bone scan. And we will have the science and the research and the stories and the information they need so that insurance company by insurance company, woman by woman, they will have this covered. It matters, doesn't it, to have that coverage, Maria?
Yes, absolutely. It does. I want to bring up another concept that kind of ties in nicely to this that has not been covered yet, and that is the cost to women, the loss in productivity, the loss in quality of life. Those are things you cannot put a price on. And by getting diagnosed early, you can avoid years of discomfort and pain and loss in income or loss of ability to do things. And so the impact is far reaching. We are not talking about one test that you find out about and then it's over and it's meaningless. This is a test that if it's done early, and the beauty of it is that it can be done at all ages and for all stages of endometriosis. So maybe you have the early stage, maybe you've got that highly inflammatory early stage endometriosis, like, as we commonly hear, oh, these teenagers are in pain, they can't go to school. Well, they're not good candidates for intravaginal ultrasounds. It's an invasive diagnostic procedure. It's not comfortable to do, and it's really not appropriate for young ladies. And so we have this test that is available to go in at a young age. You can find out they have it. Then the options are open. Now that endometriosis is going to be easier to treat in its early stage. We can cause regression with proper medication if you know what you're treating. And in pharmacy, it was always about use the best drug or the drug of choice and make sure that the drug you're giving is the right thing. So I guess the best example I can use for that is, say, with antibiotics. You wouldn't want to give an antibiotic to somebody that isn't going to impact the bacteria that's present. It has to be, you have to do a culture and sensitivity. You have to make sure it's the right thing. So with endometriosis, it's the same thing. We want to know what we're dealing with, and we want to know when it's happening. The earlier, the better. Let's deal with it at an early age so that we can save heartache for women later. I can't tell you how many women I see in their 30s and 40s who are still struggling with this, even into menopause. And let's not forget that the other thing it can impact is pregnancy. We know that women with endometriosis, not only do they struggle oftentimes with infertility, but it's the pregnancies themselves that can be unhealthy. You increase your risk of placenta previa, preeclampsia, postpartum hemorrhage. These are things that the World Health Organization has actually brought forward when they spoke to the manufacturer about the impact, like the worldwide impact and potential that this tier 1 endometriosis test has. It's far reaching. It's not just the teenagers having trouble. It's not just the women struggling with infertility or menopausal symptoms, because it does go on into menopause. This disease has the potential to keep going like the Energizer Bunny. And if we think we're going to go through a change in life, we're going to get pregnant, we're going to go into menopause, and it's all going to be over and we'll feel good again, well, that's not the way it works. And Margaret, I think with your work, you know all about that. It's how it goes through all stages. of life.
My name's Carolyn Placan. I'm the COO of Endo Diagnosis. And actually, I have my own personal story about endometriosis, but I'm also on the research side in women's health and actually spreading fertility education and awareness for women. I've been doing that for many, many years, since 2007. I just wanted to bring up the actual costs. And of course, this is a very costly disease for the Canadian healthcare system. Yet actually healthcare, that's only 22% of the costs related to this disease. Now, these are numbers from about 10 years ago. It's actually $2.5 billion a year in 2025 dollars. And we know if you can get an early diagnosis, it saves the healthcare system money as well. Because with a long delay in diagnosis, 3 to 5 years on, that short versus long delay, healthcare costs go up 37%. And it's across the spectrum. Not only diagnostics, healthcare visits, because most people jump through 10 practitioners to actually get a diagnosis, surgery that's currently required as the gold standard for diagnosis, and then all of the emergency room visits because of the debilitating pain that this causes. That's just 22% of the actual cost of the disease. Everything else is borne by the woman herself. So whenever I hear the word period poverty, I think of people with endometriosis. They're bearing 80% of that cost. And we know people who, not only is this the leading cause of them missing work, using all of their holidays because of period pain, using all of their sick days, but then they actually go down from full-time to part-time work, or they have to leave the workforce altogether. That's what tier 1 testing can do, is stop that at the earliest stage. And like I said, this is available 12 to 13 years old. If they're having symptoms, parents can bring their child in and non-invasively, painlessly, in less than an hour, you get an instant diagnosis based on the electrical activity in your gut. It's very easy to prepare for. You do an 8-hour fast from food and water before you go in, and there's a few medications you don't take in the days before. But honestly, what could these young girls and young women accomplish if pain didn't stand in their way?
Yeah.
And that's where the healthcare system adopting tier 1 testing and patients being able to get a diagnosis, they come together and go, let's do something about this before it proliferates and moves from stage 1 to stage 2, 3, 4, where they have more severe symptoms. So I'm really excited to bring this forward. I just wanted to jump in with that because it's really important for me to bring forward a solution after working with women for so many years. There was really never an answer to period pain, to irregular menstruation or very heavy menstruation, unusual bleeding. It really affected these people on a cyclical basis. And what I would say is there's like 80 plus symptoms of endometriosis. We've talked about infertility. We've talked about period pain, pelvic pain, but there are others like people with irritable bowel syndrome. You may have endometriosis, gut issues, having problems with bowel movements, having pain with urination. It was brought up the right medication for the right disease. About 20% of women with endometriosis have irritation in their bladder, and that's not treated with antibiotics. Endometriosis needs to be identified, and that needs to be treated. It's just really key. I would say if you have symptoms that are linked to your menstrual cycle, this is a good tier 1 test for you to start with.
It's time to take it seriously.
It is time to take it seriously. And everything that you said, Maria, and that you just presented, Carolyn, resonates deeply and personally for me. Not only, as you spoke about the cost to women, I lived it. I lived all of this where I missed work, I missed school, I missed life, where I had, more than 20 hospital stays in my first year of marriage, where I had a doctor in our hotel room in Greece on my honeymoon because I was in debilitating pain. I always say, a recovering type 1 personality. I'm a doer. I want to live life to its fullest. But this disease hijacked that. And I want to also clarify that it isn't always just with your period. When I had severe disease, this could be all month long, ladies. This wasn't my period. It started that way, but then it hijacked my life 24/7. And it cost me lots of money. I had to leave university earlier because I had to have surgeries. But there is hope, because when you get that diagnosis, and I was that young 13-year-old that was given a transvaginal ultrasound, really, quite frankly, I didn't understand, and against my mother's will and understanding, because she wasn't consulted. That should never have happened. And it won't now with this testing. These are real stories. I'm a real person that has experienced all of this. I was told to just get pregnant when I finally got the diagnosis at 19, to just get pregnant. I was in university and wasn't married. And what do you mean just get pregnant? I couldn't even say the word endometriosis. And then I was told to get, well, not only is it a cause of infertility, but yes, I was on bed rest with my son. Yes, I went through infertility treatments. And yes, I'm blessed with 2 children, 6 years apart. But how did that come about? It came, and this is what launched my career, from an integrative approach. Maria, as a pharmacist, talked about the pharmacological treatments, which are important. It's part of the equation. Seismic surgery is part of the equation. I've had that. I've had both. But here's where my passion and what I know worked for me, and what brings hope to other endo warriors, ones that have been diagnosed and ones that aren't yet. And they're scared to get the diagnosis, because if I had $1 for every time someone said to me, yeah, but then what do I do? Because endometriosis, nobody listens to you. An integrative approach to treatment, which includes nutrition and exercise and autonomic nervous system downregulation and regulation of the nervous system, and mental health support, because this disease penetrates every system of the body. And the cost is too great. You saw the cost on the healthcare system. You see, I'm a living proof of the cost of what it's been like to live with this disease. But I'm also the visionary behind PHAM, which is to bring hope and change in the legacy of healthcare for future generations. And this is why this roadshow on August 11th through 13th, on the 11th, we're going to be at GraceMed, the first clinic in Ontario, in Oakville, GraceMed Functional Medicine and Hormonal Health. Then we're taking the show on the road to Drip Barberry. And then its third day, we are heading to the rural community of Exeter Massage and Integrative Care, thanks to Stephanie Vandenbush and her leadership, a fellow RMT who's passionate about the PHAM movement. She's a PHAM ambassador. And we're going to welcome media. We're going to be talking to as many healthcare professionals and educating while Carolyn and Maria are in Ontario. And on behalf of Dr. Prowse and myself and Endo Diagnosis, together we can change the legacy of endometriosis. We can change the way it impacts our healthcare system, and we can improve the vitality and the health spend of women, because they deserve it. So thank you, ladies. I can't say enough about how passionate I am about this. And the countdown is on. Let's go.
Let's go. It's go time.